Before the break, we asked you if both of these pictures were of cold sores or could they be something else? Well, it turns out the one on the left is a cold sore, but the one on the right is something completely different. Dr. Batra, and you can understand how, to a layperson, they look very, very similar.
Correct.
So what's going on?
So the second one on the right is actually something called angular cheilitis, which is when the corners of your mouth start to crack and fissure and break down. And if you've ever had this, it's super painful because they're deep little fissures there.
Kylie, just refers to your lips, right?
Exactly right. Yeah, and so these are different. So when we talk about cold sores, those are caused by herpes simplex virus. And 2/3 of the population in the world have been infected with this virus, but only a very, very small percent will actually get the little blisters and vesicles that you saw on the left there. On the right, we get this when saliva pools at the corner of our mouth, really common in people with dental appliances, braces, or people just a little bit more susceptible to infection and skin breakdown, like people who are diabetics or a little bit older. And what happens is when that saliva pools, it's such a great, warm, moist place for yeast and the bacteria from your mouth to overgrow. So then it sets up shop there, it colonizes, and it perpetuates the infection. So with this, the treatment is totally different. For the angular cheilitis, it can be simple, just like petroleum jelly, or just something to hydrate it, keep a nice ointment on it so those fissures can heal. Or if you do feel like it's not getting better, you can even turn to more of an antibacterial or an anti-yeast agent. But if it's really recalcitrant, go see a doctor, have them culture it and tell you what's going on. With the cold sores, I would start with the antiviral, over-the-counter kind of antiviral and soothing remedies, and those might need more of a pill-based antiviral as well. So totally different. Cracks and fissures, corners of mouth, angular cheilitis, little blisters and vesicles on a red base on the left, that's more of a viral cold sore.
Can be quite painful.
Yeah, both can be painful, and I think that's why
Well, and if you've had the one condition, you might think that you have the oral herpes simplex virus, and you may not. And I think that's fascinating because, again, to the naked eye, very difficult to tell the difference between the two. Interestingly, some of these cold sore treatments would still be effective though, right?
Well, if they're hydrating, yeah. So if they are more ointment-based and rather than gel-based, they're probably gonna soothe it and allow it to heal. But anything with a very high alcohol content, you're gonna put it on that fissure, it's just gonna burn.
Make sure you know what you have, because if they are cold sores, extremely contagious, you don't wanna go kissing.
And if you're not sure, there are blood tests that can be done to see if you've been exposed to the HSV-1 virus.